This demonstration is a guide to injecting with the Skyrizi pre-filled syringe. Watch it and also read the entire Skyrizi instructions for use leaflet inserted with your medication package. Don't try to inject Skyrizi until your doctor has decided you can and you've been shown the right way to inject. Skyrizi, risankizumab riza uses. Skyrizi is a prescription medicine used to treat adults with moderate to severe plaque psoriasis who may benefit from taking injections or pills, systemic therapy, or treatment using ultraviolet or UV light, phototherapy. With active psoriatic arthritis, PSA. Safety considerations. Skyrizi may cause serious side effects, including serious allergic reactions. Stop using Skyrizi and get emergency medical help right away if you get any symptoms of a serious allergic reaction. Infections. Skyrizi may increase your risk of infections. Before starting treatment, your doctor should check you for infections and tuberculosis. Tell your doctor right away if you have an infection or symptoms of one. Do not use Skyrizi if you are allergic to risankizumab riza or any of the ingredients in Skyrizi. Also, tell your doctor if you plan to or recently received a vaccine.
Hey there, I'm Maya, and I'm here to walk you through how to inject yourself with Skyrizi. Now, if it's your first time, don't worry. And if it's not your first time, I hope you pick up some new tips while you're here. Now, I've done this a few times by myself, but my doctor originally walked me through how to inject, and I called Brian, who's my nurse ambassador, when I first started injecting on my own at home. All right, let's get started. So when my Skyrizi comes in the mail, it goes straight in the fridge. Now, before I inject, I let it sit out for 15 to 30 minutes out of direct sunlight to get to room temperature. And while I wait, I try to relax. Okay, that should be enough time. So once my hands are clean, I like to put out everything that I'll need. So I have my Skyrizi syringe. I have an alcohol swab, which I got from my local pharmacy. I also have the instructions for use, just in case. And I also like to grab a cotton ball. I had some right in my medicine cabinet, and then a sharps container. Now, I like this spot because there's a lot of space, and I don't have to leave my couch. So it helps me to break down the injection process into 4 simple steps, the 4 Ps. And you can see them here on the package. We have pick, prepare, pinch, push. Okay? So first, I pick my injection site. So I'll go with my left thigh, but you can also pick your right thigh or your lower stomach. But if you choose your stomach, make sure to inject at least 2 inches away from your belly button, okay? So you wanna grab your alcohol swab to clean your skin in a circular motion like this, okay? And let it dry. Now I hold my syringe with the needle facing down, and I check the liquid inside to make sure that everything looks okay. So it should be clear to slightly yellow, which it is. See that? And there's a few bubbles in there, but that's normal. So looks like we're good to go. All right, so I hold my syringe in one hand, and I take the needle cover off with the other hand, okay? Like this, and then you wanna throw it away. You see? You may see a drop of liquid at the end of the needle, which is normal, okay? So I've got my syringe in one hand, and with the other hand, I'm gently pinching the area of my clean skin to hold firmly. Now I'll inject the needle into my skin at about a 45-degree angle using a quick, short movement like this. Now holding the angle steady, I slowly push the plunger in all the way until all the liquid is injected and the syringe is empty. There we go. Now pull the needle out of my skin while keeping the syringe at the same angle like this, and I release the plunger to allow the syringe to move up until the entire needle is covered up by the needle guard. See how that works? The needle guard won't come back down unless all the liquid has been injected. All right, so now I press my cotton ball where I just injected, and that's it. I drop my used syringe in one of these handy sharp disposal containers, and voila, safe and sound. Now I'll just put it back out of reach, and just like that, another injection complete. So to recap, I prepare myself in my space. I pick an injection site, prepare the syringe, pinch the skin, push the plunger in, and safely discard the syringe. That's the whole injection process. Now, it seemed tricky at first, but I got it down soon enough. And Brian, my nurse ambassador, he recommended I create a routine, injecting at the same time, same place, that sort of thing. I also do something nice for myself after each injection. Maybe I'll paint as a reward. Oh, and the Skyrizi Complete app has helped me so much. I mean, I use it to log my first starter dose, so I knew when to take my second starter dose 4 weeks later. You can set reminders for future doses too. Since after 2 starter doses, Skyrizi is only 1 injection 4 times a year. And when I get those reminders, I know to contact my specialty pharmacy to get my next injection on time. I'm lucky to have people around to support me. I've got Skyrizi Complete on my team too, like Brian, who's such a good listener. In this app, there's always someone to reach out to if you need help. You've got this.
Uses and important safety information. Skyrizi, risankizumab riza uses. Skyrizi is a prescription medicine used to treat adults with moderate to severe plaque psoriasis who may benefit from taking injections or pills, systemic therapy, or treatment using ultraviolet or UV light, phototherapy, with active psoriatic arthritis, PSA. Important safety information. What is the most important information I should know about Skyrizi, risankizumab riza? Skyrizi is a prescription medicine that may cause serious side effects, including serious allergic reactions. Stop using Skyrizi and get emergency medical help right away if you get any of the following symptoms of a serious allergic reaction: fainting, dizziness, feeling lightheaded, low blood pressure, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness, skin rash, hives, itching. Infections. Skyrizi may lower the ability of your immune system to fight infections and may increase your risk of infections. Your healthcare provider should check you for infections and tuberculosis, TB, before starting treatment with Skyrizi, and may treat you for TB before you begin treatment with Skyrizi if you have a history of TB or have active TB. Your healthcare provider should watch you closely for signs and symptoms of TB during and after treatment with Skyrizi. Tell your healthcare provider right away if you have an infection or have symptoms of an infection, including fever, sweats, or chills, cough, shortness of breath, blood in your mucus, phlegm, muscle aches, warm, red, or painful skin, or sores on your body different from your psoriasis, weight loss, diarrhea or stomach pain, burning when you urinate, or urinating more often than normal. Do not use Skyrizi if you are allergic to risankizumab riza or any of the ingredients in Skyrizi. See the medication guide or consumer brief summary for a complete list of ingredients. Before using Skyrizi, tell your healthcare provider about all of your medical conditions, including if you have any of the conditions or symptoms listed in the section, "What is the most important information I should know about Skyrizi?" Have an infection that does not go away or that keeps coming back. Have TB or have been in close contact with someone with TB. Have recently received or are scheduled to receive an immunization, vaccine. Medications that interact with the immune system may increase your risk of getting an infection after receiving live vaccines. You should avoid receiving live vaccines right before, during, or right after treatment with Skyrizi. Tell your healthcare provider that you are taking Skyrizi before receiving a vaccine. Are pregnant or plan to become pregnant. It is not known if Skyrizi can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Skyrizi passes into your breast milk. Become pregnant while taking Skyrizi. You are encouraged to enroll in the pregnancy registry, which is used to collect information about the health of you and your baby. Talk to your healthcare provider or call 1-877-302-2161 to enroll in this registry. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Skyrizi? Skyrizi may cause serious side effects. See, what is the most important information I should know about Skyrizi? The most common side effects of Skyrizi in people treated for plaque psoriasis and psoriatic arthritis include upper respiratory infections, headache, feeling tired, injection site reactions, and fungal skin infections. These are not all of the possible side effects of Skyrizi. Call your doctor for medical advice about side effects. Use Skyrizi exactly as your healthcare provider tells you to use it. Skyrizi is available in a 150 milliliter pre-filled syringe and pen. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. If you are having difficulty paying for your medicine, AbbVie may be able to help. Visit AbbVie.com/patient access support to learn more. Please see link for the full prescribing information, including the medication guide for Skyrizi.